As a community health outreach worker, I am a patient advocate and I connect patients with resources in the community. I often go to appointments and accompany patients, and really I just am like the bridge between the provider and the patient.
Our complex care program consists of an RN case manager, a social worker, and a community health worker. They are embedded in our primary care clinics. They integrate within the clinic with primary care providers. We care for very high-risk patients, and those patients require care coordination across multiple specialties.
I met Anthony in May of 2018, and when I first met him, he had a cirrhosis. He has diabetes, high blood pressure, high cholesterol, and his ammonia levels were really high. I met his sisters at the same time that I met him because he was just very confused and he wanted the complex care team to speak with his family.
Complex care program. I remember Dr. Lake mentioning it to us when we met Gladys and the nurse. They came to this house and they were amazing. Both of them were amazing and just followed through with everything.
There was a big concern because he wasn't really taking his medication as prescribed, mainly because he was forgetting. We brainstormed ways to help him remember to take his medication, and we actually used our resources here in the Hayward Wellness Center. We used the urine cup, sterile urine cups. They were clean, but you know, that's what we had here. And we used that and a cookie sheet from his home to create this MediSet, like a medication reminder system for him. Hey, we gotta use what we have, right? He still needed something else, which was a new liver. We vouched for him to be evaluated for a liver transplant consideration.
She drove all the way out to San Francisco, more than once, and she was with me for all my talks with the doctors, and she would ask questions that I would forget. She had it all written down in a binder. She's the one that kind of got me to do the operation too, because I didn't know if I wanted to do it. I was afraid. And she kept bugging me and says, yeah, you need to do it, and this and that and the other thing. So I did. Dr. Lake was such a preventative doctor, preventative medicine, you know? And Gladys, she's been nothing but helpful. She's been just so good to me and keeping an eye on me and asking me questions all the time. She's got me going to a nutritionist down there now.
We recognized Dr. Lake and Gladys in our weekly gratitude rounds during huddle in front of the team. And Gladys said, you know, I'm just doing my job. And what I wanted to refresh with the team was, it's when we design systems and have resources in place, such as this collaboration between primary care and complex care and embedding it in the home, the medical home, then people just do their jobs and great outcomes happen.
I would like to thank Gladys and Dr. Lake for saving my brother.
I am just grateful and very privileged to have had that opportunity to help Anthony and his family. I know that because I live, other people's lives is better. And to me, that's just a huge, just satisfaction.